Okay, now we're going to talk about artificial insemination. And artificial insemination generally is going to be required because you can't get natural breeding. Conception rate is best with natural breeding, so if you can get that, that should be your goal. But sometimes the dogs are going to be geographically distant, or there's a size mismatch, or the male is dead and you're using frozen semen from him. Many reasons why we might choose to use this particular advanced sort of technology. So when we think about artificial insemination, there's two halves of it. One of it is how are we going to put the sample into the female, the actual insemination piece. And the other half is what kind of semen are we going to use. And I'll talk first about how we actually introduce it into the female. So there are a couple of different places that we can put the semen. We can introduce it vaginally, or we can introduce it directly into the uterus. When we direct it into the uterus, there's a couple of ways you can do it. You can either do it surgically, where you actually open up her abdomen, pull out her uterus and inject it through the wall of the uterus, or you can try to do it through her vagina and through her cervix. And there are a couple of different ways that has been described. One of them I'm not going to talk about very much, and that's the use of the Norwegian or Scandinavian pipette. This is a blind technique where you palpate the dog's abdomen to feel her cervix and then pass the rigid pipette through her vagina till you feel it hitting the cervix and then pop it up through into the uterus. That has a very steep learning curve. Many people do not learn this technique well, and it is a blind technique. And for that reason, many people have chosen not to do it. I have not chosen to learn to use that technique. The other way to do it through the vagina and the cervix is to use an endoscope. And an endoscope is a long, lighted scope that lets you see exactly where you're going. The problem, remember, is that this is a dog, and so she's got this enormously long vagina with that big fold of tissue that hangs from the ceiling, and that makes it very difficult for us to pass instruments. So you need to have an endoscope that's a very, very narrow diameter and that's quite long. The one that we use at the University of Minnesota, we actually can use to look into the bladder. So it has to be narrow enough that I can also pass it down the urethra. So as you might imagine, this is a very narrow diameter endoscope, something that many veterinarians would have no use for in their general practice. And so many veterinarians do not offer this because they don't have that specific equipment. And I'll show you how all three of these procedures are done. For vaginal insemination, because we're just going to put it into the vagina, you don't need very specialized equipment. And what you're seeing on these slides are different kinds of pipettes that we can use. And a pipette is really just a hollow plastic tube, clean, hollow plastic tube. And then it has that blue, what's called a lure lock on the end. And that allows you to attach a syringe to it so you can pull semen up and push it back out through the pipette using that syringe. Anything you introduce into the vagina of the dog, remember you have to introduce it dorsally, sort of aim up to get it into the vagina. You don't want to go in ventrally at the bottom of that cleft of the vulva because you'll just put everything into the clitoral fossa. That's a dead end. I myself like to put my index finger in first. So I'll put a glove on my left hand because I'm right-handed. I will introduce my finger first and then flip my hand over. And that way the entrance into her urinary bladder is under my finger. And that way I know for sure I'm not risking at all passing that pipette into her urinary bladder. I will pass the pipette over my finger as far forward as I can get it to go without making her uncomfortable. Then pull it back a little bit so I know I'm not stuck up against the wall, and then you just inject the semen through that pipette, followed up with a little bit of air. And we'll pull it out. I'll tickle the ceiling of her vagina for a minute. That'll make her contract around my finger. We believe that helps move the sperm forward. And then some people will also do what's shown here on the slide, where they'll sort of wheelbarrow the dog up. And the idea is that you're allowing that semen to pool around her cervix by doing that. Vaginal insemination requires that the semen be in pretty good shape. So we're most commonly going to do this with fresh semen, where we collect it and immediately put it into the bitch, or with chilled semen, where the sperm are still in pretty good condition. Transcervical insemination is one of the intrauterine techniques, and this is the one again where you use the long endoscope so you can see where you're going. So the picture shown here on the right is showing the veterinarian who has passed the endoscope, which is a long metal scope, in the length of the vagina in the dog. And right now what that veterinarian is doing is passing a catheter through the top of that scope that will go wherever the end of the scope is pointed. So what that veterinarian is doing is looking at the cervix and then passing that long polypropylene urinary catheter through the cervix. This is complicated by the length of the vagina, that fold of tissue that blocks much of the vagina, and the fact that the cervix hangs from the ceiling. So you sort of have to, if this is the cervix, you sort of have to balance your endoscope against it and then twirl that catheter to get it to bank off and go through the cervix and get up into the uterus. This is most easily done by attaching the endoscope to a camera, and you can see here on the slide, you can see a TV screen in the back, and that's so the veterinarian can be watching what's happening. She's doing everything here and watching it distantly. That's much easier than trying to look through the endoscope itself. The image on the left is showing you the cervix. So that sort of rosette of pinkish white tissue that you see, that's the cervix. And what looks like sort of a bar that's going in across the top is that polypropylene catheter. So that is the cervix with a catheter passed through it. And then you just, again, introduce the semen through that with a syringe. The final method of insemination, again, this is another intrauterine insemination method, and that's surgical insemination. And with surgical insemination, we put her under general anesthesia, prepare her abdomen the way we would for any other abdominal surgery, drape her off appropriately, and then we make an incision into her abdomen, pull out her uterus, and place either a catheter or some other device into it that allows us, again, to use our syringe and just introduce the semen into the uterus. Then you pull out your needle, just hold it for a second. You don't need to put a suture in there or anything. Drop it back into her abdomen and close her up. As you can see, with our two intrauterine techniques, either the transcervical endoscopic technique or the surgical technique, there are going to be pros and cons of those two techniques. So the biggest pro of the transcervical technique is that that does not require anesthesia. Most bitches, you don't even need to provide any sedative at all. They tolerate it really well. So that also means you can do it more than once in a given heat cycle, that you could breed her on her optimal breeding day, and again, perhaps 2 days later with the transcervical technique with no problem. The downside is you don't really get to see her reproductive tract. With surgical insemination, the biggest downside is you have to put her through general anesthesia, which is a risk and a cost. So there's going to be both economic and health concerns if you do the surgical. But sometimes it's great to do the surgical insemination because you get to see and feel their reproductive tract, and sometimes that answers a lot of questions for you, especially with bitches that you've been having trouble getting pregnant. The other half of it then to think about is what kind of semen are we going to use? And different kinds of semen are going to require different kinds of insemination techniques. So first let's talk about fresh semen. Fresh semen you're probably going to use when you have behavioral incompatibilities where the female will just not allow the male to breed her, or size compatibilities, things of that nature, where the male and the female are both in the building, but you collect the male and then immediately put the semen into the female. You collect it the same way we described it before. You don't have to handle it, you don't have to store it, you don't have to add anything to it. So it is very good quality semen. And generally you're going to be able to handle it the way you would natural breeding, which means you can introduce it vaginally and you want to do your inseminations on sort of those optimal days we talked about before. So at least once, 2 days after ovulation, and then another time. And I'll usually do it 2 and 4 days after ovulation. Fresh chilled semen is collected routinely, but then placed in an extender, which is a nutrient medium that also protects the sperm from cold shock. And then you chill it to refrigerator temperature and you ship it. And the whole time it's being shipped, it has to be maintained at refrigerator temperature. So we will usually do that in styrofoam containers with ice packs to maintain that, not freezing, but cold refrigerator type temperatures for that extended semen. As the sperm metabolize or use up the nutrients that are in that medium, they will start to die. So you really want to get the sample to the female as quickly as you can. Most people are going to try to ship it using some sort of overnight service or ship it counter to counter to the airport. And I will tell you that usually the problem is going to be the shipping. It's very rarely cooperation on either side with the veterinarian in charge of the male or the veterinarian in charge of the female. It's generally that it gets lost somewhere by a shipper. If you ship it counter to counter with using an airline, that pilot does have the right to refuse to carry an unaccompanied box. So I have had times that my box didn't make it onto the plane at all. The pilot also has the right to open an unaccompanied box, and they don't have to repack it the way that they found it. And that's to look for things like explosives. So I guess I'm happy they do that because I don't want to blow up on a plane. But I have had times that my samples came to me with no ice packs in them. And again, all of the sperm were dead. And that's a risk that you run when you're doing this chilled semen breeding and you're shipping it that way. If it gets to where it's going within about 24 hours, again, this is usually very good quality semen. The sperm have not been damaged that much. And so again, you can usually do vaginal insemination with these. And again, I would do more than one, and I would do 2 and 4 days after ovulation. I will very often get the question, well, could we just ship it once and you put half of it in 2 days after ovulation and just leave the rest in the fridge and put it again 2 days later? And that's not really recommended. The sperm are going to live much better in the bitch than they are in the refrigerator. So if you've got a sample, you might as well put it into the bitch, and the sperm will be there when those eggs are ready to be fertilized. The last kind of semen that we use is frozen semen. Frozen semen have been manipulated quite a bit. So what you do is collect the sample, as we did before. Usually then you will centrifuge it to remove all the fluid, so you have just the sperm. You will put it in 1 or 2 very specific extenders and freeze it very gradually until it is completely frozen, and it has to be maintained in that frozen state in liquid nitrogen until you're ready to thaw it and use it. So it has to be stored in liquid nitrogen, it has to be shipped in liquid nitrogen. If it's done properly, as far as we know, it will last for decades. I have used 25-year-old semen that looked just fine when I thawed it. So the biggest value of this is for those dogs that are dead. I mean, I've used semen from dogs that had been gone for a long time. One concern about that is that dog styles sort of change over time. So how do you know that your winning collie right now is going to be a winning collie 25 years from now? Maybe the style that we're looking for will have changed, or maybe we'll have discovered health concerns that we don't want to use that collie anymore. So I think that very long-term storage is probably most valuable for things like guide dogs, where there's a pretty clear idea of what size they want, what sort of temperament they want, what sort of working ability they want, and that probably isn't going to change much over time. When you freeze and thaw cells, you risk rupturing those cells, killing those cells. And so these spermatozoa have really been much more damaged. And that means they have a much narrower window of time that they're going to live once you thaw them. And that means you really need to have your timing very perfect to make sure that the eggs are there and ready to be fertilized when you introduce those sperm. So we will generally hedge a little bit, breed her a little bit later, maybe 3 or 4 days after ovulation. And generally, you're going to want to put that sample directly into the uterus. And you could do that either with the transcervical route or with the surgical route. Or what some people will do will be to try to sort of get the best of both worlds and do 1 surgical and 1 transcervical. And there's certainly nothing wrong with doing that as long as you know you have enough semen to be able to do that. The conception rate is best with natural service. Nothing that we do is as good as natural service. And sometimes your conception rate will be good with artificial insemination just because you had to do breeding management. You had to make sure you were breeding on the right day. And sometimes that in and of itself helps improve your conception rate. But there's no question we do not generally do as well as natural breeding. With fresh semen, you're going to be very close to natural breeding. Chilled semen, your conception rate is going to come down a little bit. And frozen semen, it comes down a bit more. Now, you may read in the literature people who get much better numbers than I'm describing to you here, and that is probably true if you work with a veterinarian who freezes their semen themselves and then is the one who thaws that semen and uses it. If you work with a veterinarian like me who gets semen from lots of different places and has to follow a lot of different protocols for thawing it, then your conception rate is going to be less just because there's no way we're that technically adept to be able to handle all those different systems. And with that, I'm happy to answer any questions you may have.